Does asthma make you more vulnerable to COVID-19?
The name of this podcast is Asthmaniac. I'm Dr. Tim Reichon, and I designed this podcast to give my asthma patients essential information about asthma. My goal is to put asthma patients in control of their breathing, preventing asthma attacks, and pursuing active, rested, and fulfilled lives with confidence.
Patients with chronic disease, including chronic lung disease, are having much more trouble with COVID-19. Many are dying when they become infected. To be sure, having advanced age and asthma is a very concerning combination, but even young people with asthma should be concerned. This is the time to get serious about asthma. Your best defense is a strong offense. Compared to the lungs of a person without asthma, your asthma lungs experience inflammation much more easily. This tendency towards inflammation can be controlled by inhaled steroids and in some cases new immunomodulators, and keeping a lid on this baseline inflammation should be our top priority all the time, but especially during this COVID-19 pandemic. How does the COVID-19 virus interact with your lungs? When it enters your body, the COVID-19 virus attaches to the lining in the back of your throat. From there, it moves to the airways of your lungs, which we call bronchi and bronchioles. Once there, the virus particles attach to and hijack the manufacturing processes of the airway cells. The result is these cells pump out a continuous stream of virus particles. When your immune system spots airway cells that have been taken over by the virus, it attacks them with vengeance. The result is inflammation. If your airways are already experiencing out-of-control inflammation, this is a disaster. The addition of virus invasion and immune attack blows holes in tiny blood vessels, causing the lungs to fill with blood. Airflow is blocked, and then you have a life-threatening inability to breathe. The amount of virus matters here. The more virus particles that you get into your mouth, nose, and eyes, the more likely you will develop a severe infection with a dangerous inflammatory reaction. Look, it's virtually impossible for every person on the planet to completely avoid COVID-19, but getting the smallest amount of exposure at any given time should be your goal. So keep a distance from people who might be carrying the virus. This includes people that aren't having fever or cough at all. And mask up. Wear a face covering. I know this is so hard to get your mind around, like, for how long are we going to have to do this? Nobody can say just yet. We just have to focus on each day doing everything we can to keep those lungs in good working condition. Down the road, we can hang up these designer masks and go to crowded concerts and, well, get back to normal. In the meantime, let's keep asthma under control. Complete the subscription form on the left if you'd like to get an email when I post a new podcast and blog entry. And as always, thanks for listening.
Asthmaniac is all online, all about asthma. Your go-to for asthma doctor visits, asthma medication refills, personalized asthma action plans, and asthma education. Asthmaniac.com.